I've always been a working mother, and so I think I got into a rut to where, I would make sure the kids were taken care of before I would make sure I was taking care of myself. I've always been one of them people, oh, well, if they said cancer, I would just be like, so what? But that's not true when it happens, because it scared me enough to make me throw them cigarettes away that I've been smoking for 50 years. My daughter kept saying, Mom, she's a nurse, my daughter's a nurse, and she kept saying, Mom, you really need to go get a primary doctor, because I hadn't had a primary physician for like 10 years. So I went back for the PET scan, and then they indeed said that they thought they found a spot on my lung, and that it was probably going to have to be taken care of, and I, of course, really didn't know any doctors. But when referred, then my daughter suggested Dr. Khanna.
We had a serious conversation, and she wanted the least invasive strategy available to her in terms of getting this cancer out. And after a lengthy discussion, we talked about doing the robotic surgery, which she was very agreeable to and excited about.
We'd have no problem, and he began to explain about the robot, which I have since named Leo, and the fact that he would like to use the robot, and would that be okay? And at the whole time he's talking to me, he's talking to me like he's my brother, or maybe my father even, and he's much younger than me. But he was just so comforting.
Even though it's called robot, it's merely the robot or the Da Vinci instrument replicates your movements outside the body, inside the body. I do a majority of my lung surgeries, if not all of them, utilizing the robot, primarily because I think it offers the least invasive strategy for the patients. It's the smallest incisions, the least pain, but more importantly, the fastest recovery to their normal lifestyle that the patients can get.
It's a scary thing. But everybody, from Dr. Khanna to the hospital, to all the people there involved, they made it such a good experience that I wasn't the least bit sorry that I had done it.
I do believe it's an advantage for the community that Halifax Health, in collaboration with the University of Florida, is investing in the latest medical technologies and advancements available so that their patients can benefit from it.
You just feel like even if it's bigger than it is, and if I'd had to have all those treatments, it wouldn't have mattered. Because I was going to be all right. I would never go anyplace else but Halifax Health.